Hi, this is Dr. Farah Sultan, and I have here with me Melanie, and I would love to talk to Melanie about her experience here at Vitology. So, Melanie, tell us how you were feeling, what symptoms you were experiencing when you came here to see us.
Really, the underlying issue that brought me here predominantly was unexplained high blood pressure that kind of came out of left field, that I just was not comfortable with just throwing medication to solve the problem. And I had a history of working with functional medicine outside of Birmingham in the past, and I realized that I wanted a relationship with a practitioner that I could meet with in person and that could help me get to the root of what I was trying to solve.
Amazing. And so, what made you choose this route? You mentioned you had tried functional medicine prior to this. So, why this, and why did this sort of an approach, which is a little different, make more sense to you? And what made you take that step?
You know, I often think that traditional medicine practices are necessary. Let me say that,
Yes.
and are
Totally agree.
critical. But I often think that their solution to symptoms or issues is to just write another prescription and stack them up until the symptoms go away. And for me, I was more concerned about what was causing my elevated blood pressure than I was remedying the elevated blood pressure. And so to me, the idea that I could come and work with you and your team to really peel back the layers of the onion to see what potentially could be causing my high blood pressure was why I came. And what was amazing is the first day that I came to see Dr. Sultan, within 5 minutes, you said to me, I said, oh, I've got a cough. This cough. I cannot kick this cough. I've got to get to ENT. And you said to me, well, what medicine are you taking for this blood pressure that did cardiology put you on? And I said, oh, I'm taking lisinopril. And Dr. Sultan said to me, well, that's your cough. It was within 5 minutes that I would never have thought to say to cardiology, well, I've got a cough. But because I was working with a practitioner that was thinking holistically, that was looking at the big picture, who also had a deep understanding, including a board certification in traditional medicine, oh, your cough is caused by your blood pressure medicine. So that's a really great example of how I saw immediate relief in an issue just by having a practitioner that could look at the 10,000 foot.
Awesome. Thank you so much for sharing that. And then how have your symptoms changed over the course of time? How are you feeling then as compared to now?
Great question. I have, the detox process was, I should back up and say, I have always lived cleanly. I'm a college athlete. I didn't need some of the traditional things that maybe a functional practitioner would prescribe because that's just a part of my everyday life. But what's been amazing about this process is I've realized there are things that I need to pay more attention to in consuming less gluten, in consuming less dairy. And there have been nutritional changes that I've just made slightly that I really do think I feel much, much better. I think we did some really deep dive on lab works that diagnosed some things, that we've done some antibiotic treatments and some things that were required. And I really do think that I feel better. The other great thing is that my blood pressure we have worked on from a holistic perspective, but we've also navigated traditional medicine because we have to, and we have combined what's effective with traditional medicine and holistic approach together to get a really good outcome. And it's something that I hope to never change, and I feel really good about the process.
Yeah, and that's so wonderful to see how our body can respond to those lifestyle changes. And yes, medication and allopathic medicine has a role for sure, But when we balance it with lifestyle, it can really be a game changer. And so, since you've experienced this firsthand, Melanie, what is your advice and motivation and inspiration to others who may be struggling with something similar, or maybe confused or frustrated, or just fearful of taking the next step in something like this?
You know, it's as I was saying to you earlier, I'm 50 with a 6-year-old, and
Your kids keep you younger.
My kids are keeping me young, and I gotta. This is a long game for me.
Yes.
I've got to be able to ski the backcountry, run around the playground. I've got a lot of keeping up to do as a later in life mom. And what I would encourage people to really think about of all the beauty that can come of peeling back the onion and looking at things that you have no idea maybe are there, but with some slight adjustments, you can feel so much better and more energized. The other thing that I think is you realize when you do things that don't make you feel great, that what it centers you back to what does make you feel great. And that this is not about a radical, I eat and drink for a living.
Yes.
That is what I do for a living. I work with chefs and restaurants and winemakers, and I can't live a perfectly clean lifestyle 100% of the time, but it's not intended. That if we can make good choices 80-90% of the time, enjoy, and then come back to center about what works for us, because this process has taught me that what is right for my body is not what's right for your body. Exactly. And that this is not a recipe that's definitive, but this is very individual based on the lab results and the information that you will glean through the process, and that's what I think has the most value.
Thank you so much, and I love your gratitude bracelet.
But
I love the way you said peel back the layers of the onions, and not everyone is same, as well as the 80-20 rule, because living healthy needn't be difficult. It may be a little different, and we should still be able to enjoy the things we love and travel and eat out and all the rest of it. So thank you so much for being here today, for taking the time and for sharing your story.
Thank you.
Thank you.